So today we're going to be talking about the importance of pre-screening. Medicare agencies have about 3 different ways of getting leads. New opportunities, people who are interested in Medicare coming their way. And they're usually from one of 2 sources. One is called O&O. So these are owned and operated web properties, lead magnets, webinars, etc. So this is all in-house. This is like your own website. If you run your own ads as an agency, if you do content, webinars, etc. Then you have the third-party stuff, which is usually referred to as affiliate traffic. This is where you're either purchasing leads. So the customer, the prospect, is filling out a form online, and then that data is getting sent to you. Now, the cool thing about leads is that it's totally in your control what happens after, of course, that lead is submitted. The challenge, however, is you need to figure out how to contact those people. And workforce management is a really big challenge when you need to chase folks down. And you already paid for this lead. So you don't want to pay for a lead and then potentially not be able to get in contact with them. The alternative is pay per call, which has become increasingly popular in recent years. The reason for that is, as opposed to procuring leads, you're actually buying consumer-initiated inbound calls. You don't need to then worry about calling that person and getting in touch with them. They're actually on the line live and hypothetically ready to discuss plans. Now, we often say that retention starts at the enrollment. However, big realization we've had is retention actually starts before the enrollment, and it starts with what kinds of leads you are getting in. So are they of high intent? Are they of eligibility to discuss Medicare? And frankly, the affiliate marketing model is really challenging because of the incentives involved. So affiliates work entirely on a performance basis. And so they have their own web properties, and their goal is to generate calls or leads. Now, ideally, this content is CMS approved and compliant. Often, frankly, it's not. But let's say that you have really strong partners that you trust as lead sources, they're vetted. Now, there's going to be a few pieces of creative here that are more generic, let's say, and generating really high quality, high intent people who are well educated about what they're going to discuss on the line with an agent when they call in. That's great. However, those are very expensive to generate leads, frankly. Your cost per lead is going to be in the many tens of dollars, and your CPA is likely going to be above your target. As a result, people need to mix in these other lead sources that are a little bit more, let's say, creative, right? So what you see is a lot of affiliates trying to reduce their CPL, their cost per lead, or their cost per call, their CPC. They're going to mix in some creative here that is marketing more fringe benefits offered by Medicare Advantage plans. You know, things like OTC cards. Now, they're not lying in this creative, but what is an OTC card? It allows you to purchase various things, and it's an included benefit with Medicare plans. They, as creative marketers, will extrapolate these things that you can buy with an OTC card, and they will advertise that. They'll show, a picture of Betty really excited with a bunch of free groceries. Now Betty sees this ad on Facebook and calls in, and the intent is not to discuss Medicare plans. The intent is free groceries, which presents a massive challenge once Betty then connects with a licensed agent, because there's now a mismatch in the intent and the expectations between the consumer calling in and the agent on the other side of the phone. So what does this do? This clogs up lines with a lot of unnecessary volume of people who are not necessarily having intent or eligible to discuss plans. And as a result, these are powerful, tremendously important, valuable minutes that agents are wasting on the phone with people that they potentially should not be on the phone with. On top of that, you're likely paying for leads and calls that you shouldn't necessarily have to pay for. So it's a necessary evil, because the O&O stuff is low volume and you need to fill in the volume with affiliate traffic. So this is why we created pre-screen. Now, what does pre-screening do? At a high level, what pre-screening does is it makes sure that every single time your agents connect on the phone with a prospect, it's someone who is eligible and interested in exploring Medicare plans. It's that simple. Now, it can also do a lot of other cool things like capture scope of appointment, as well as capture some needs information for needs analysis. Now, eligible and interested, this is simply making sure that when people connect to an agent, it is the right person. It's a good lead. These other 2 are more in the interest of saving your agent's time, so that when they connect with these eligible and interested people, they don't really need to worry about scoping it out. And they can jump right into needs analysis as well as plan comparison. So shaving off potentially 5, 10, 20 minutes of the enrollment call, allowing them to produce more. Now, there's 2 ways that we handle pre-screening scenarios, and they correspond to those different types of lead sources that we talked about. So in many scenarios, you are either generating or purchasing calls. So this is inbound, we use IB. Or you're purchasing leads, whereby naturally the next step is you need to call these leads outbound and get in touch with them. So the careCycle sales suite handles both of these in unique ways. So if you're dealing with inbound calls, the first thing you need visibility of is your sources. So source tracking is really important. That means if you're procuring calls from 10 different affiliate partners as well as generating your own, you need to have visibility into things like the qualification rate. So how often are the leads coming from this source eligible and interested? Your transfer rate. So this is transfer rate from the AI pre-screener to your agents, and your close rate. Now all of these end up coming together to give you visibility of your CPA, your cost per acquisition. So our goal with source tracking is giving you real-time visibility of your cost per acquisition by source, so you can either double down on the ones that are working or turn off the ones that aren't working and really take control of the marketing budget and your CPA. Now, as we track these sources, we're gonna ask customers a few questions, right? So there's some basic ones like Medicare Parts A and B. Do you have Medicare Parts A and B? What is your existing coverage? This is where we check for things like dual eligibility. We're gonna capture, if it's an inbound call, we don't have their zip code, some information about where they're based, so we're gonna grab their zip code. And this can be passed in to determine routing for which agent we're gonna route to based on which states they're licensed in. Now, this is the basic pre-screening just to make sure that people are eligible. It verifies, okay, you are interested in discussing Medicare plans today. Great, let me connect you with somebody. And it's really incredibly surprising how powerful that simple question can be to save agents time on the phone. From here though, we can do a lot of other things getting into scope of appointment. So actually capturing and documenting for compliance purposes what is going to take place in this call with the agent, and then capturing preliminary information beyond their existing coverage, things like their doctors, their prescriptions, and their pharmacies. Now this data is not only captured conversationally, but it's captured out as structured data and then passed into the CRM in real time, which allows you to get straight into quoting and enrollment and actually writing the app, comparing plans based on the inputted doctors, prescriptions, and pharmacies. Now, when we talk about buying leads, there's another variable for us to consider here, which is the contact rate. A lot of the agencies we speak with, they're buying or they're generating leads. One of their biggest challenges is contact rate. So they're generating and they're buying hundreds of leads, whether it be on Google, Facebook, third-party affiliates, native advertising, whatever it might be. And then they can't get in touch with these folks. And agents are spending a lot of their time on dialer systems, simply like trying to get someone on the line. So this is also what the outbound form of the sales suite handles. So the second a form is submitted, it's incredibly important that you get instant speed to lead. And this is one of those obvious use cases of AI that produces a ton of lift, but it's nothing particularly fancy. When you're generating leads or buying leads, you might get 500 at the same time, or you might get 5 in an hour. It's virtually impossible, really at a small scale or a high scale, to staff precisely the right amount of people such that the second somebody fills out a web form, they can instantly receive a phone call to follow up on that and really get them into next steps. Now that's what AI allows, right? Someone fills out a form, we instantly call them, and we can begin capturing the scope of appointment, checking for eligibility, and either transfer to a licensed agent or schedule an appointment to get them in with a licensed agent. Now, what if we don't contact people? This is where a lot of the work we do around multi-agent orchestration becomes very important. Most traditional contact center solutions are strictly outbound. So you outbound dial, and a lot of people have probably experienced this. You miss a call from some 1-800 number, and you call it back and it just beeps. So in our experience, about 10 to 20% of people that we outbound dial and miss end up calling back inbound. So what we've done is we know this person's number because we're calling them. We have data on hand. When they call back inbound, not only are they not just hearing beeps, but they're also greeted by first name, and they can pick up right where they left off as though they picked up our initial call attempt after they filled out the form. So inbound, outbound capability is really important, and the personalization that comes along with inbound, outbound capability. The other thing is simply having observability and configurability over your dialing cadence. So there's an entire art and science around dialing cadences and optimizing contact rates. Instant speed to lead is as good as it gets in terms of the first initial contact attempt. But of course, that's not 100%. So you need to have a strategy for redialing people that same day or the following day, which we include. And we also go a step further with SMS. So in the case that somebody just filled out a form and that form stipulates that you can expect to receive a call right now, of course, people are expecting a call. But what if you're redialing them a day later or 2 days later? We find that sending a simple SMS message 5 minutes before we call them is incredibly useful for increasing contact rate. We see increases of contact rate of 20+% every time we implement this. So simply letting people know in an outbound dialing context why we're dialing them, who we are, and providing them a proactive opportunity to opt out ends up mitigating costs and increasing contact rate dramatically. We also do a missed call SMS, which has a lot of cool features involved that are more intent driven. So sometimes you're calling people a day later and they might be driving. Now, a subpar AI system that's built statically and doesn't take these corner cases into account is going to totally flounder on that interaction. They're going to call people, they're either going to miss them or they're going to get on the line and it's going to be like, hey, I'm driving, and the bot's going to have no idea what to do. So we have embedded appointment booking functionality both on SMS and calls. So if we miss someone when we try to dial them, we just send a follow-up and say, hey, just reply yes whenever you want to call. This is what we're trying to reach you about. Or let me know when works well for a call. They can say, hey, call me tomorrow. careCycle will automatically call them the next day. And in the meantime, it'll deposit that into the agent's schedule so that they can expect that appointment to take place. And that's really the same whether we're in an inbound contact center scenario or we're more independent agent, working with independent agents who operate off of calendars on their appointments on their calendar. So this is what pre-screening is all about. And it can range from a couple of quick questions just to make sure that people have Medicare Parts A and B, and they're eligible and they're interested, all the way up to needs capture and scope of appointment. Now, how much we do on these calls, on the actual AI assistant interactions themselves, depends entirely on the lead source and the intent associated with that. So some lead sources are very high volume, very low intent. You can only really get away with asking 2 or 3 questions max before you want to transfer them over to an agent. Because one thing to keep in mind, one thing that we do not oversell at all, is that voice AI is incredible for being helpful and informative and doing things like pre-screening. It is not really at the level that it has the salesmanship that you need from a licensed agent. So our goal at the end of the day is transfer over to an agent as quickly as possible. So in the case that we have a low intent lead source, this is determined by the data that we see in early days on transfer rates. We might decide to either dial down the questions that we ask or dial them up if we can afford to handle more of the interaction and save more agent time. But really this is all, once again, with the idea of reducing CPA in mind. We're reducing CPA in mind with a few things. So we're pre-screening low intent or ineligible leads. And every minute that your agents aren't on the phone with someone who's low intent or ineligible is another minute they can spend on the phone with people who are high intent and eligible. Did I say that right? I'm going to say it again. Every minute that your agents spend on the phone with people who are low intent or ineligible is a minute that they could have instead spent with people who are of high intent and eligible. So this is exactly what we do by pre-screening. So we're pre-screening them out. We're saving agent time as a result. In the case that you're buying pay-per-call traffic, for example, on a 90-second buffer duration, we're reducing lead cost, meaning simply that we're screening people out before they hit that buffer duration, so you don't need to pay for that call that you shouldn't have to pay for to begin with. And this is all without an agent even having to interact with the call. And then we're creating more observability. It's been absolutely mind-blowing to learn that when we speak with a lot of agencies, they actually don't have systems in place to measure their cost per acquisition accurately across different sources. They might have piecemeal metrics. They might track things like their average duration of calls with agents from different sources, but these are all just heuristics. They're just proxies. So by actually measuring your real CPA and your cost per transfer and your contact rate by source, that visibility allows you to really optimize which sources you're focusing on and allocating your budget toward. So that's really an overview of pre-screening, inbound, outbound capabilities, handling O&O traffic as well as affiliate traffic, and designing custom dialogues for each source that really pertain to the nature of that traffic, right? Whether it's a higher volume, lower intent source, more generic, or maybe it's affiliate traffic and you don't even know what the creative is coming in. You want to handle that, of course, in terms of dialogue design differently from someone who's a referral coming directly from your website. So with source tracking, we're able to actually have different personalized dialogues for each source as well. And this is one of those things that is really easy for AI to do, but once again would be really challenging with regular humans dealing with calls all day from 10 different sources. To actually mode switch and use a completely different script for the opening dialogue for each source is incredibly challenging to deal with, especially when you're focused on trying to sell and doing high quality plan reviews. So we find that having a dedicated dialogue that actually, for example, uses the messaging on the landing page that they landed on before the call helps create a lot of trust, familiarity, and these dialogues go a lot better, also resulting in a lower CPA.